Demand for services versus healthcare reform. The demand for healthcare services is continuously growing. This becomes quite evident when one tries to book an appointment with a physician or has to sit in a crowded waiting room for long periods of time. With the availability of new breakthrough medicines and treatments comes higher demand. The new healthcare reform law will put an even higher demand on healthcare providers as more people become insured. In Bergen County, New Jersey, we have a prime example of the demand for services versus impending healthcare reform, which I call the Pascack Valley Hospital dilemma. While the healthcare reform bill aims to provide more individuals with the opportunity for healthcare with less government spending, the demand for services for newly insured patients may have a significant impact on the healthcare industry as a whole. The Pascack Valley Hospital dilemma. The dilemma happening in Bergen County, New Jersey, and how it exemplifies the demand for services versus healthcare reform. The campaign is a case study of the formidable obstacles confronting President Barack Obama and Congress as they try to mine savings from the $2.5 trillion healthcare system. Tens of billions of dollars must be found to keep healthcare spending from gobbling up an increasing share of the economy and thwarting efforts to insure all Americans. Standing in the way are strong financial incentives and public enthusiasm for the latest and often most expensive facilities, technologies, and procedures. There's also powerful resistance to making do with less. Pascack Valley Hospital was a 291-bed hospital in Westwood, New Jersey, which closed in November of 2007. An expensive building expansion caused the hospital to go into bankruptcy and close soon after. However, local public demand and business investors looked to reopen this facility against strong opposition from other nearby facilities. The two facilities opposing the reopening of the hospital are Valley and Englewood Hospitals. Both of these facilities have had substantial gains since the closing of PVH. Many local citizens want the facility reopened for easier access to healthcare services. Westwood elderly say a resurrected hospital would make it easier to get to doctor's appointments, dialysis, radiation treatments, and physical therapy. I'm supposed to go for lab work every 3 months, said Teresa Giannoni, 76, a retired housekeeper. I've been stretching it for 5 months. The healthcare reform law calls for more to be insured, but with less government spending. It makes no sense, Commission member David Hunter, a consultant and former hospital executive, said in an interview. He said adding a hospital is an especially bad idea since Congress and Obama are focused on extracting large savings from the healthcare system. When you're heading into this much uncertainty, it's not a time to be adding any capacity, Hunter said. The current and soon-to-be increasing demand is clear. However, the new healthcare reform law looks to increase patient capacity without increasing provider capacity. Healthcare reform. What will happen with the enforcement of the healthcare reform law and possible consequences facing the healthcare industry? 3 goals of healthcare reform. There are 3 goals that are hoping to be achieved from healthcare reform. These goals are cost containment, access, and quality. Would you work more for less pay? Obviously, the answer is no. This is what will happen for physician practices in hospitals with healthcare reform. The current Medicare and Medicaid reimbursement rates are the lowest among other types of insurances. With healthcare reform, most people will be on a public plan that is comparable to Medicare and Medicaid coverage. So healthcare providers will have to serve many more patients with less government funds and being reimbursed at a lower rate than what they are already receiving. Something is not adding up. From what we see with the Pascack Valley Hospital dilemma, by now you should see that something is not adding up. How can you take funding away from healthcare, add access for more patients, and get higher quality? The answer is that you can't. It is possible to contain costs and add more access, but the quality of services will be far from desirable unless physician capacity is also increased. The following clip is a brief explanation of how healthcare reform will impact healthcare services from the aspect of a provider. In conclusion, as we have seen, the demand for healthcare services is already at a peak. The healthcare reform law will challenge an already overburdened healthcare system. As we can see from the Pascack Valley Hospital dilemma, increased demand for services will not increase physician capacity. Furthermore, increased demand will wound the quality of healthcare services as physicians struggle to meet the expectations of increased demand and decreased revenue. We all dream of a utopian system, where everyone will have all the care they will ever need. However, reality dictates that we may not have the necessary resources to make this dream a reality.